Hello friends, this is a journey of a middle-aged lady who presented to us with acute right shoulder pain. She was unable to lift her arm and do her daily activities. Even things like wearing clothes, tying her hair and doing a routine course at home were painful because of right shoulder. We investigated her, found out that she was suffering from a complete rotator cuff tear on an MRI scan. And then we guided and counseled her that she would need a arthroscopic rotator cuff repair. So this is a minimally invasive surgery in which we look at your shoulder with a small camera and we find out the torn part of the muscle tendon, that is the rotator cuff, and we repair it with multiple suture anchors or bioabsorbable small screws with attached threads which tie the muscles back. After the procedure, patient is started on exercises. She was undergoing an extensive rehabilitation program at home which involved a lot of strengthening and flexibility exercises using free weights, TheraBands and stretching using her own body weight. She was able to lift dumbbells and free weights at 4 months follow-up. She even sent us a video showing her doing a Surya Namaskar without any pain, and she was very motivated to get back to her routine by proper rehabilitation. She continued strengthening her shoulder using various body weight and strengthening exercises. She stepped up the TheraBand program, and this is her hanging from a bar without any discomfort and the same shoulder supporting her own body weight without any pain. If you or your loved ones are suffering from a shoulder pain, it could be a rotator cuff tear, get in touch with your sports surgeon today.